Hi, this is Dr. Matt Rasmussen from Periodontics and Implant Dentistry of Tallahassee. We've been getting more and more questions about the connection between the health of someone's gums and periodontal disease, as well as their systemic health, meaning the health of their overall body, meaning the mouth and body connection. One of the most common questions we get in our office is, how is oral health and heart health connected? Well, there is an oral systemic link. So there's many things that can affect the body coming from the oral cavity. One interesting fact is that the mouth is one of the only places in the body, is really the only place in the body, where there's actually a connection outside of the body from something inside of the body. Meaning if you think of all of your bones, they're all inside of your skin. But your teeth come through your gums, allowing an opportunity for bacteria to break in. That's where the oral systemic link comes into place. A very common aspect of this that we get asked is, how does gum health and gum disease affect overall heart health? There has been a correlation between the bacteria that exists in the mouth underneath the gums to the same bacteria that live in the plaques of the arteries of the heart. So what we have noted is that with oral treatments, many patients live longer, and that's a very important aspect of overall care. Of course, medical treatments are very important as well in listening to your physicians, but again, it makes sense that keeping your mouth healthy should make you an overall healthier person. Another common question that we get in our office is about oral disease, meaning periodontal disease, and diabetes. Typically type 2, but can also be type 1 diabetes. Diabetes is a very common condition that many of our patients have. And the question becomes, can oral treatments help with the management of diabetes? And also vice versa. There is evidence to say that certain periodontal treatments that reduce bacteria in the mouth can have an impact on the person's A1C values. Basically, the overall way that the body is being taken care of in terms of their diabetic status, meaning the higher the number, the worse it's being taken care of. There is data to support that, that there's an overall impact in that direction. And so some common tips and tricks as far as making sure that we maximize that value would be getting in for any consistent non-surgical treatments such as deep cleanings, known as scaling and root planing, or periodontal maintenance visits, and just doing the proper tips and tricks to keeping our teeth clean at home, meaning brushing for a full 2 minutes every night, as well as using string floss and other aids that are recommended by your dental professional. Now, the opposite is also true. So certain dental treatments will be more successful with appropriate diabetes management. So we need to make sure that we get into our physicians as well to get our A1C and other lab values under perfect control. Another question that comes up is, what happens with pregnancy and oral health? Meaning dental visits and appropriate treatments during pregnancy. Now, when a mother is expecting a baby, there are many hormonal changes that occur in the body. Some of these make that person more susceptible to certain types of disease. One of the most common is periodontal disease. You'll often hear an old wives' tale that every time I had a baby, I lost a tooth. Well, what was really happening there was the person was having hormonal changes and some gum problems going on that weren't addressed that time and they lost a tooth. Now, did you know that periodontal disease has a direct correlation with low-term birth weight for the baby? So this isn't just about the mom, this is also about the baby. So it's important to make sure that we're getting appropriate checkups for non-invasive treatments during pregnancy. I hope we had the opportunity to answer some of the most common questions that we have regarding the oral and systemic connection. When you're ready to schedule your exam, give us a call at area code 850-692-9200. Let's get you healthy.